Welcome back to Eagle News Mornings from Canada. I'm Marco Zeruto. The Ontario government is taking over management of high-risk long-term care homes. Eagle News correspondent Ashley Sackmar has the details to this story.
The Ontario government is taking needed steps by taking over the management of high-risk long-term care homes in response to the disturbing report outlined by the Canadian Armed Forces. Earlier this week, the Canadian Armed Forces released a report that outlined claims of abuse and neglect against senior residents, deprived home conditions, and the lack of proper care from the staff.
And that report was heartbreaking. I appreciate the great work of the Canadian Forces in our long-term care homes, and I'm grateful that they have now agreed to stay on until at least June the 12th. I'll not shy away from the horrors we found. Everyone deserved to see what was happening, because it's the only way we'll be able to bring these issues to light.
As a result, the Ministry of Long-Term Care has deployed inspection teams to conduct detailed and rigorous investigations at high-risk long-term care homes over the next 21 days. The process of appointing temporary management has also started for the following long-term care homes: Edenville Care Center, Hawthorne Place Care Center, Ultimate Care Community, Orchard Villa, and Camilla Care Community. Premier Doug Ford outlines the details of this takeover.
We're deploying 6 teams of 2 inspectors to each of the 5 homes highlighted in the Armed Forces report, as well as the Camilla Care Home in Mississauga. They will undertake an expanded and rigorous inspection and monitoring of these homes for a period of 2 weeks. At least one of these inspectors will stay at their assigned home over that entire period to watch over our residents there. They will conduct in-depth interviews with staff and residents, review charts and records, and report back with their findings.
After the inspection is completed, the ministry will set up regular status calls, including unannounced in-person follow-up inspections. All results from the inspections will be posted on the ministry website. The Premier expressed that he will not take any hesitation to take more aggressive steps if any home is still found performing below the standard of care.
But I won't hesitate to take the long-term care patients out of those homes and put them in another home or in the hospital if we have to. But I really want them to have their corrective actions in place and be a good operator. I don't think it's too hard. When you have the vast majority of these homes that are good operators, I don't know why these are so bad. It's poor management, in my opinion. It starts at the top.
However, not all long-term care homes suffer from the reported deplorable conditions. The Premier reassured the public that the rest of the long-term care homes across the province are doing well in caring for the respective senior residents.
There's 626 homes. I think close to 80% haven't been infected. We have incredible people that are sacrificing themselves every single day going into these homes, helping people. You know, we had a bad situation on a few of these homes. I don't want the message out there that they aren't doing their jobs. They're working their backs off. They're sacrificing their families. They're putting themselves ahead of, the community ahead of themselves.
The outbreak of COVID-19 has caused not only the spread of the virus, but the exposure of the dark realities that have been happening in some of these long-term care homes. It goes without saying that after years of giving their life for their families, communities, and to the country, the senior members of the community do deserve care, respect, and compassion. In Toronto, Ashley Sackmar, Eagle News, we live in interesting times.